Where do you see the profession evolving in the next 5 to 10 years, especially with hopefully some incoming PBM reform?
Yeah, so hopefully with PBM reform, I think that's something we've been fighting for forever. It was something I knew as a student, and here we are still 5 years later. Hopefully, if we can get good PBM reform that gets price transparency out there, gets reimbursement rates at a level that can sustain pharmacy practice, hopefully, us pharmacists can get out there more than just behind the counter dispensing. If we can get that PBM reform and get the payment needed, we can provide better services to our patients. Lots of states have already started prescribing different meds. As pharmacists, we can do that. We take, years and years of pharmacology. So hopefully, if with PBM reform, you can see your pharmacists doing more of that work, especially in the rural areas where it's hard to get to a doctor's office. But also, hopefully, seeing the pharmacists more out in the community at like festivals, parades, like being out there and, getting the pharmacist back into the community, I think is key because we are one of the most accessible health professions out there. So, being there for our patients and making sure our patients can afford, get their medications, but then further that and offer all of these different types of clinical services for them.
And see, that's a good point because I feel like the general idea of what a pharmacist is from somebody who's uneducated is it's somebody prescribing your prescriptions behind a counter. But like you mentioned, it seems like the profession is so much more varied than that.